Welcome to Clear Answers About Clear Vision, the exclusive podcast series by Vance Thompson Vision. Our goal is to empower you with the knowledge and insights to make informed decisions about your eye care. Whether you're exploring options for vision correction, cataract surgery, myopia control, or oculoplastics, we're here to guide you. This podcast is dedicated to helping you achieve clear vision, one episode at a time.
Hi, everyone. Welcome to a new year, new you. We're going to be talking about oculoplastic surgery. And so today I have two very special guests within Vance Thompson Vision. I'm Deb Ristvedt. I'm a surgeon in Alexandria, Minnesota. I focus on cataract surgery, glaucoma surgery, and oculoplastics, which we're going to get into. And Dr. Schmidt, introduce yourself.
Yeah, hi, Jason Schmidt. I am one of the optometrists here, also in Alexandria, Minnesota, working with Deb. And we'll dive into a little bit about what my role is versus what the surgeon role is.
And Dr. Meckles is
Yeah,
joining us from, do we say like Husky country or corn country?
I won't say Cornhusker Country. We'll just go with Omaha. So I'm Keegan Meckles. I'm our newest surgeon here at Vance Thompson Vision. I'm at the Omaha location, and I do oculoplastic surgery full time here.
And Dr. Meckles, I'm going to start with you because a lot of people come into our office in Alexandria and they say, "Oh, I didn't even know that you did this type of work." Can you explain to people what oculoplastics is and what your training looks like?
Yeah. So I think a lot of people hear plastic surgery and they get a certain notion about it. Oculoplastics is a branch off of ophthalmology. So I think a lot of people in ophthalmology residency get some oculoplastics training. The ASOPers training that some of us do is another 2 years after that. And really, oculoplastics is facial plastic surgery. I like to say from the neck up. We learn a lot of neck lift, facelift, rhinoplasty, those sorts of things. But really, it works best in our practice when we're focusing mostly periocular. So brows, forehead, eyelids, those sorts of things. And I think another good thing to touch on is the difference between what functional and cosmetic oculoplastics is, and there are two big branches of that, right? So functional would be essentially something that is a medical necessity that you are going to get paid for by insurance because it makes your life better, it improves it in some way medically. Whereas there's the whole cosmetic side of things where maybe there's not a medical necessity, but it's something you'd really love done. And sometimes there's even some overlap between some of those procedures.
And I love that you're differentiating the two because it's not that surgery changes all that much, but it's whether insurance pays for one versus the other. And so, Dr. Schmidt, when we're talking about functional eyelid surgery, a lot of patients don't know that insurance will cover these procedures. What do we have to prove where it's affecting their vision?
Yeah, so when the patients come in, we're looking at mainly four things. One, it has to be a vision concern. Like there's something that they're not maybe seeing their surroundings like they should. They're having to tip their head back a lot. They're having to raise their eyebrows. There's something that they're having to do that's bothering them. And so there's a chief complaint that goes with why they want to have this done. And then we look at some measurements. Their eyelid has to be a certain height above their pupil. And if that is lower than what a normal range would be, that's the second thing we look at. And then we measure their peripheral vision. There's a test that we shine lights in their periphery. And if they see all those lights, probably see a lot less of those lights, and then we raise their eyelid up to where it should be, then we can show that they're improving their field of view by 30 degrees or more. And then we take pictures to support all that. So if they've got all four of those things, those are kind of typically what the insurance companies, Medicare typically bases that off, and the other insurance companies follow that.
And Dr. Meckles, when we talk about redundant eyelid skin or having bags under the eye, some things are covered like we talked about, but some things are cosmetic. Can you do multiple procedures in this little area? And what do we do in that area to improve the look?
Yeah. So I think breaking it down into what's functional and what's cosmetic, and sometimes what overlaps is a good way to do it. So I think probably one of the most common things we do, and something that I think a lot of patients have heard, is a phrase called blepharoplasty. And you can do that of the upper eyelids and of the lower eyelids. So I would say the majority of the upper blepharoplasty that I do is a medically covered surgery. And a lot of those patients will notice excess eyelid skin, and you'll notice it coming off, a lot of it laterally out here, almost like a little blinder, touching the eyelashes, overlapping the eyelashes, um, going over so far where we can obscure the pupil itself. And those are the people who are really going to get a functional benefit out of an upper blepharoplasty. Blepharoplasty is also something that can be cosmetically done. Some patients don't like the way that the fullness of their upper eyelid appears. And while it might not be to the medical standard, it's certainly something where we can give, like a female patient, more of a palette to put makeup on, or just to reduce a little bit of that heavy appearance in a full brow. And then there's also lower blepharoplasty. Lower blepharoplasty is almost always going to be a cosmetic procedure. And with lower blepharoplasty, I think the bigger thing that people notice is I have these dark circles underneath my eyes, or I don't like how puffy it looks underneath my eyes. And that's because I think that the reason people have that is more of a fat issue and not always so much an excess skin issue. And so what we can do is we can go down and we can reshape and remove some of those lower eyelid fat pads and get rid of that dark circle appearance that people have that say give them that tired appearance or that puffy appearance.
What do you guys say for downtime? If it's just an upper eyelid procedure, what does the recovery look like, Dr. Schmidt?
Yeah, I mean, patients really don't look too bad even the next day. There's going to be a little bit of bruising and swelling. Kind of depends a lot if they're on uh, blood thinners and such. And I recommend, I don't know if you guys do too, but to use like Arnicare, that really helps with minimizing bruising and swelling a lot. But they might have a stitch in their upper eyelid for a week or so, and then they come back and we take care of that. But for just a skin removal procedure, I mean, the downtime is pretty minimal. You see the same. There isn't a lot of pain in any of this. You get a little bruising and swelling. We remove the stitches in a week or so, and they can kind of go on to their normal activities even the next day.
And what about scar recovery, Dr. Meckles? What do you tell patients or instruct patients on regarding scars? And do you see them if we do good surgery in the uppers or the lowers?
I love the prerequisite of good surgery. So luckily, because the eyelids don't have any subcutaneous fat, they are incredibly forgiving when it comes to scarring. That being said, it's not impossible to have a poor scar appearance. Some things I do personally to mitigate that is I use non-absorbable stitch when I do upper blepharoplasty. Really easy to do and take out at 1 week. A lot of times I just cut one end and the whole thing just pulls out. Patients aren't in any pain from that. They say it kind of feels tickle like you're pulling out a loose hair or something like that, but really well tolerated. And that's for the upper eyelids. I rarely use absorbable stitch. Now you can, and those patients might have what I call little lumpy bumpies. They might have a little raised pink or red area along that eyelid for a few months, but generally after a few months, even those fade off into oblivion. And then when I do lower blepharoplasty, I'm usually doing them, I would say the majority, doing that transconjunctival approach. So from the inside of the eyelid. So those patients, for two reasons. One, they're at no risk of an external scar because there is no external incision. And two, the risk of lower eyelid retraction is much less when you're doing a transconjunctival approach versus doing one on the outside of the eyelid where you're actually making an outside cut.
Yeah, I like that approach as well. Patients do very well. And I always say, give it more time for healing if you're doing both the uppers and the lowers. Because, again, it really depends on the anatomy, it depends on the patient, and depends on the procedure we do. But we'll instruct you on timing. But if you have a family reunion coming up, or if you have an event or a holiday coming up, how long should we instruct our patients to wait or to give time to that event?
I can go ahead with this one. I'm a pretty big proponent of give yourself more time than you think. For an upper lid procedure like a bleph, I'd say, I usually on this, like I'm a very conservative side, I say about a month, just so we almost certainly you are gonna not have bruising and your swelling is gonna be back to baseline in about a month. I always tell patients at least 6 after a lower bleph, maybe even more than that. I would say, there's a pretty big window there where if you have an event coming up in 3 weeks, 4 weeks, just let's schedule it on the other side of it just to be safe. There's no rush, especially with elective procedure like a lower blepharoplasty.
Yeah, and I love that answer because we would rather be safe and allow your body to heal because everyone is different. But even, scar time, scar recovery time, can be up to 6 months to a year. But like you said, Keegan, it just fades into oblivion. And that's where, we really want you to have surgery with well-trained surgeons that really know that anatomy, and beyond. So beyond when I talk about other things we can do, there's also skin laser rejuvenation, where say you come in and you just want a refreshed look. Well, there's nothing like having a refreshed look from your eyes themselves where you don't look tired anymore. You don't look like your eyes are half closed. So that's the blepharoplasty part. And then also over time, with sun damage or with age, we form wrinkles, we see imperfections from sunspots or from vascularization. And those things can really affect the appearance too. And so not only are we trained to do surgery, but also skin laser rejuvenation, which really is done in conjunction with surgery to allow for that week downtime as well.
Yeah.
Keegan, do you like CO2 or do you like erbium laser?
I've used both. I just got my new CO2 laser here, so my office staff is getting a little practice on my new toy. I'm a big fan of fractionated laser in general. And the CO2 laser I think is tried and true. Been around for a very long time. It's what I'm most used to. That being said, I've known people who've used erbium lasers, and I think it's, in your whoever's hands, and it's a little bit of personal preference too. But yeah, I think I work best with the CO2 laser.
And Dr. Schmidt, how do you have that conversation with patients when they come in? Do you have a lot of patients that are excited about maybe fixing some imperfections at the time of their blepharoplasty?
You know, I use the analogy of like when you go to the dentist a little bit. Sometimes you go there and you don't really have any concerns, but they find things that, right, that you want to address and make sure that things don't get worse down the road. And I think when patients come in to see me for cataracts, for, glaucoma, for whatever, it's pointing out those things that maybe were on their mind but didn't know how to ask the question. And so it's like, hey, your eyelid's a little bit low. Did anybody talk to you about that? Or are you noticing that you've got extra skin hanging on the eyelid, or the eyelid's a little bit lower, whatever, or just the texture, the appearance of the skin. And I think then that just opens the door to new conversations. They didn't realize that's something that we could do or could, they would qualify for. Let's dive into this a little more. I mean, we had an open house just the other night, and patients were asking all kinds of questions like that. And so I think that's part of my role, is to identify the chief complaint and why they're here, but to also talk about other things that I see when they come in.
Yeah, I love that. And you'll find at our sites at Vance Thompson Vision, we have optometrists and ophthalmologists that work as a team. And that's why I get to be in the operating room and use my skill set, is because I have people like Dr. Schmidt seeing you on consultation. And then we talk about pictures, we review things before we even meet. And so that's kind of a neat way to have multiple eyes on you. A lot of patients will say, well, am I going to look different? Am I going to look like Kenny Rogers? I don't know why Kenny Rogers is so picked on, but he is. So, Dr. Meckles, what do you say to patients that are asking you, will this change my appearance?
So I think that the best way I go about doing this is kind of going from the opposite side of I don't want to look like Kenny Rogers. Like, no, I don't want that either. My hope is that people look at you and they think that they think something might have been done, but they're just not sure. And I think that's a sign of a natural look. No one should ever look at you and say, "Oh, wow, that person definitely had something done." I think if people are questioning it, there's nothing wrong with that. I push natural look to my patients a lot. That means not having a completely flat upper eyelid palette when we're talking about a post-blepharoplasty patient. A subtle fold with some space between the lashes is great. On the lower eyelids, it can be you can hollow somebody out by taking too much fat. You can do the same in the upper eyelids. You can leave somebody with A-frame defect where their upper sulcus is way too hollow after blepharoplasty, and that's what happens when you go to a really aggressive surgeon who doesn't really take into account, what's natural, what looks best, not, what's the most that we can do. That's not always the best approach.
I love that. And that's the biggest piece of advice I got in residency, less is more. And there's just a beautiful way to do this surgery where you look refreshed and natural without really knowing that you had anything done. And that's our goal actually as surgeons. We don't want to be too aggressive. But it's amazing too when we talk about the functional side, how patients come back saying, gosh, I did not realize how much I wasn't seeing out to the side. Because just like cataracts, it happens so gradually and they're used to that. Or they may have really deep crevices in their forehead because they've been raising their eyebrows for all these years. And so it's fun to be able to take care of patients in this way. And guys, I'm so thankful for both of you. I'm thankful to be in Vance Thompson Vision, just taking care of patients, doing the right thing on a day-to-day basis. And this has been so much fun. I always love seeing you guys and interacting and learning from you. And hopefully we can do it again.
I agree. This has been a lot. I think this is my first actual group podcast that I've done with Vance Thompson Vision. So, incredibly thankful that we have such an awesome group to share ideas, bounce things off of, and yeah, a bunch of like-minded people who just want to do the best for our patients.
Awesome.
Yeah, and I think, if we're looking at a new year coming up, if patients are out there looking for that improvement before their class reunion in the summer, so it'd be nice to see the first part of the year.
Thanks everyone for joining us.
Awesome.
Thank you for listening to Clear Answers About Clear Vision, the exclusive podcast by Vance Thompson Vision. We hope this episode has empowered you to take the next step toward achieving clear vision. If you found this information helpful, please share it with a friend who might benefit too. Ready to take the next step? Schedule an evaluation with our expert team or visit us online at vancethompsonvision.com to learn more. Together, we'll help you see the world more clearly, one decision at a time. Until next time, take care and keep your vision worth seeing.